epidemiologist, Dr. Josh Clayton, and Florida Department of Health Communications Director, Daniel Bucciarelli. At this time, we will turn it over to Daniel Bucciarelli for updated COVID-19 data.
Good morning, everyone. Thank you for joining today's conference call. South Dakota's Department of Health has thrived on bringing South Dakotans and members of the media the most up-to-date health as it becomes available. To that end, here's the latest statewide numbers as of this morning. New confirmed cases, 200. New probable cases, 77. Active infections, 4,103. Recovered cases, 100,293. Current hospitalized, 195. Total tests performed, 842,111. Total persons tested, 303,343 unique persons. 100,063 positive.
I know, because it's like a weird spot.
280 negative persons. Just as a reminder, we can please mute on your line as we progress through this week's conference call. We're currently reporting the RT-PCR positivity rates since the measures being used by CDC as well as CMS for nursing homes and long-term care facility reopening plans. That last 7-day number as of this morning is 11.2%. Additionally, 58,456 doses have been administered to 48,491 people. South Dakota remains among the states leading the efforts nationwide. All this data can be found on COVID dashboard, which can be found at doh.sd.gov. Just as a reminder, the data reported on the dashboard is considered provisional and is updated as data becomes available. I will now turn it over to our state epidemiologist, Dr. Joshua Clayton.
All right. Good morning, everyone, and thank you, Daniel, for the updated numbers. Just wanted to provide 2 updates just around cases as well as around what we're doing for sequencing related to COVID-19. So our recent lower overall, but also lower hospitalization and deaths. So our declines in COVID-19 testing have correlated with decreasing COVID-19 cases. Despite the decrease in testing, the percent RT-PCR test positivity rate has also been decreasing, which points to ample testing capacity with South Dakota for those who are symptomatic and seeking testing. The decrease in COVID-19 cases, hospitalizations, and deaths South Dakota come at a time when the United States is in resurgence of COVID-19. So it's important for South Dakotans to remain vigilant and take precautions. Precautions include physically distancing greater than 6 feet, avoiding crowds, and wearing a mask when that physical distancing is not possible. Also paying attention to cough and hand hygiene and washing your hands. Stay home when you're sick with COVID-19 symptoms. The other updates I'd like to provide is that we are monitoring for the emergence of the UK strain, and we'll be continuing to provide important updates in the coming weeks and months. The information that we're providing today is related to an MMWR article that was published last Friday. And again, it restates that there are no known differences in clinical outcomes between the COVID-19 and the UK strain. But the UK strain of that B117 variant has now been found in over 30 countries as well as in 20 states, and that does surrounding states of Minnesota and Wyoming. A couple of the talking points just related to the variant is that it's projected to be the predominant variant in the United States in March, and that due to the higher rate of transmission, it will likely lead to more cases. And so we do need to be cognizant that it will increase the number of persons overall who need clinical care, as well as exacerbate the burden on the healthcare system. We do note that increased transmissibility will also require a greater adherence to and use of vaccination, and for there, higher coverage must be attained in order to achieve the same level of disease control as less transmissible variants. and maintenance of our mitigation measures, as I mentioned, distancing, masks, and hygiene. The other thing that I want to just touch on is that it does offer us some opportunity with our increasing number of tests overall, that individuals are able to get tested, whether they have symptoms of COVID-19 or have been identified as a close contact to a person with COVID-19, that we do recommend that those individuals be tested. Now, just providing a quick update in terms of how we compare nationally. So the U.S. case rate for the past 7 days was 66.8 cases per 100,000, and that compares to the South Dakota case rate of 38.4 per 100,000. So we ranked 39th highest. And so for our COVID-19 vaccination, as Daniel provided the numbers of individuals and doses that had been administered, that does put the South Dakota one-dose coverage at about 5.4%, which is the third highest in the nation. And the two-dose coverage for South Dakotans at 1.1%, which is, again, the third highest in the nation. So with that, I will turn it over to Secretary Nelson-Reisman.
And just as a reminder, if you can please mute your lines until we get to the question and answer section. Thank you.
Thank you, Dr. Clayton, for that update. So just continuing to provide some information around vaccines. Since our last call, over 48,490 South Dakotans have received the COVID-19 vaccine, and 9,965 South Dakotans have completed the full two-dose vaccination process. So we are making significant progress, and again, shots in arms is really what our goal is. I think the other thing to keep in mind is that we have had a great team at the Department of Health working every single day, all day on vaccination logistics, and working with our partners who have also been great. Those partners include Avera Health, Mobridge Regional Hospital, Monument Health, the Northern Plains Consortium, and Sanford Health. And I just can't say enough about their hard work and their continued efforts to get vaccines out to folks. The other thing we remain committed to is transparency, and so continue to look at the dashboard and the information that we are putting out to help inform people about vaccination efforts in our state. I wanted to take this opportunity to share one just very recent example of how we have seen just people come together in South Dakota to be part of the solution when it comes to vaccines. And so in addition to our partners that we're working with, we also have the issue of logistically getting this vaccine to different locations. And because of the storage requirements associated with the two vaccines, that can be a tricky process. And so last week when we were getting our allocation, I just want to kind of walk through this because it's a neat story. So last Friday, our vaccine shipments were delayed from when we anticipated getting them, and we didn't get them into Sioux Falls until about 4:30 p.m. From that point, they went to the FedEx sorting facility, and Avera and Sanford, since they're located in Sioux Falls, got their vaccines about 7:30 p.m. But what we had the quandary of was how to get that vaccine to other parts of our state, including Watertown, Mobridge, and Rapid City. And so what happened is because the initial allocation was delayed, FedEx didn't have people waiting to get those on the road to those other locations. And so when that became evident, FedEx took it upon themselves to hunt down and locate drivers to deliver the rest of the vaccine that night. And so all the vaccine that we got on Friday at 4:30 p.m. was delivered across this state in some unfavorable weather conditions by 12:15 a.m. And so, again, I just feel really good about the fact that there's just so many people that are willing to help and willing to inconvenience themselves to be part of this solution, and that's what's going to help us be successful as well. I just want to remind everybody that, again, we are in a very limited phase of the 1D population, and, we will progress through that population as we get allocated. At this point, the allocation that we're getting at the state level, about 11,000 doses. and that represents 11,000 new people that we can vaccinate. But it does mean that we are still in that limited 1D population, including people that are age 80 and older, high risk that are getting dialysis, who are post-transplant, or who are actively battling cancer, and then certain high-risk residents in congregate settings, including some licensed independent living facilities and licensed group homes. Just as a reminder, if you are registered for this conference call today, we'll get you an infographic after the call, audiences that help inform people about who we're able to vaccinate at this point. As we get more allocation, we will continue to move through that 1D population, and we're excited for that day to come. The other pitch I just want to quickly make is, again, thank you for helping us get the word out about free COVID-19 saliva tests. People can go to our website and request the test. You don't need symptoms. And again, that testing at home is safe, secure, and fast, and we really just part of our way to help people prepare and not panic.
Okay. Thank you, Madam Secretary, Dr. Clayton, and Daniel for these updates. At this time, we would like to open the floor for questions and answers. If you could please identify yourself, your outlet, and ask your question. Also, we would ask that you only unmute if you're going to ask a question. Can we please have the first question?
This is Ben Chase with the Huron Plainsman.
Go ahead, Ben.
Yes. Do we have any numbers in the state right now of adverse reactions with the vaccine?
So at this point, as we have routine calls with our phase 1 vaccinators, we've not had any severe reactions as some other states have seen. What I would say is that we do invite individuals and their medical providers to report any adverse reactions, local pain and swelling and redness at the injection site, and that is the majority of what we have seen so far. We have had two individuals who have had about 24 hours after their initial injection, where both two individuals who have died, but again, we're in constant contact with medical providers and coroners for those two instances, and it has not been identified that the COVID vaccine has been involved in either of those occurrences. So we do continue to monitor for all impacts of and adverse reactions to the COVID vaccine, and those are the two most severe issues that we have seen arise, but again have not been linked to the COVID vaccination.
Okay. Next question, please.
Morgan.
Go ahead, Morgan. Morgan, please ask your question. Okay, can we have the next question, please?
Sorry, I think I was wrong.
Okay, I'm going to go to Morgan first, and then we'll go to...
Sorry about that, guys. I was just going to ask, I don't know if you're allowed to say this, but can you say what county those two individuals were from, and if would they be listed as coronavirus deaths, or?
No, the two individuals are not listed as coronavirus deaths. One individual, had received the COVID vaccine and had not had COVID-19 infection, and the other person, was, it was after they had recovered from COVID-19. The two counties are Hutchinson and Pennington counties.
Thank you. Next question, please.
Jeremy Silverberg, Forum News Service.
I heard Jeremy.
Yeah, thanks. I just wondered, with this UK variant, obviously going to show up at some point in South Dakota, is the Department of Health looking at changing or altering in any way the messaging that they're putting out there in terms of what the public needs to be doing to reduce the spread of COVID-19 and specifically this variant?
Jeremy, no, the recommendations remain the same, and that includes, again, staying away from other individuals, wearing a mask if you can't, good hand hygiene, get tested, and those recommendations that we've been talking about now for several months.
Okay, next question, please.
Brett Mayerson, KTIV News 4.
Go ahead.
This is going to be a two-parter, if that's okay. One part being, do you guys have exact numbers on how many people in South Dakota have received the COVID-19 vaccine?
Yeah.
And, yeah, go ahead.
Yeah, go ahead. And so the number of individuals who have received the COVID-19 vaccine, and this would be either their first or their second dose, is 48,491. And in total, the number of doses that have been given, and again, we have some individuals who have completed their two-dose series, is 58,456 doses of COVID-19 vaccine.
You said that was 49, sorry, can you repeat that second number again?
Yes, so the number of doses that have been administered is 58,456, and both of those numbers are found on the covid.sd.gov website. Go to our dashboard, and then on the top right-hand side, you'll be able to see and click on the vaccines tab, and that information is updated on a daily basis.
Okay, and my second part to that question is, so I know you guys said you were in phase 1B. Does it seem like the speed of phase 1B has been what you guys were hoping for in terms of moving along with the vaccine process?
So this is Secretary Malcolm Rice, and I just want to clarify that per the state's vaccination plan, we are in phase 1D, as in dog. So
I thought you said B, my bad. It didn't sound, it sounded different on my phone.
Yep, so it's 1D. And, again, I think we are anxious for the days when we see a larger allocation of vaccine to our state, because we are ready to get shots in arms.
Okay. Next question, please.
Eric Leonard, KELOLAND News.
I heard KELOLAND News.
Awesome. My question is about masks. I'm looking at a tweet from the CDC on January 16th talking about the importance of 2 layers with the mask, and then watching the inauguration, you could see many people with the 2 masks on. I was just wondering if you guys have received any other guidance on the effectiveness of masks and what wearing 2 masks could do.
So this is Dr. Clayton. Yeah, we do know that the quality of the material, does have an impact in terms of the ability to mitigate or decrease the risk of transmission. The discussion around 2 layers is really most masks, most cloth masks, I should say, can be doubled up and have 2 different layers, and so that does go back to taking a look at some of the patterns that CDC has and some of the guidance around the masks that they produce, or sorry, not that they produce, but the masks that they recommend, does show that you're typically folding the piece of cloth over at least once so that you have 2 layers of the same fabric to help decrease the amount of respiratory droplets that are added into the air when somebody coughs, talks, or sneezes while wearing those masks. When it does come to the masks, and this is a common thing in many medical areas, whether it's long-term care, acute care, or going to a dental clinic and so on, you'll see that individuals are typically wearing a 1 layer of mask that remains on them during their entire time. of interaction with patients, and then they'll change that outer layer of mask between patients, and that is in a way to help increase the length of use for some of those different masks out there. So oftentimes if an individual is fit tested, that will be an N95 mask that will be covered by a medical grade surgical mask. And so, I do anticipate that many individuals will use a two-mask approach. And when we're talking about the cloth masks, we do ask that that be 2 layers of the same fabric, just to cover the mouth and nose, as you're either doing a home-produced mask or looking at purchasing a mask.
Okay. Next question, please.
Yeah, this is Jonathan with the Argus Leader.
Go ahead, Jonathan.
Thanks. Hey, just going back to vaccines really quickly, have you guys received any reports then of vaccines being spoiled? I know some other states have had that issue.
Jonathan, this is Kim. No, we have not. We have, again, one of our goals is getting vaccines out as soon as we get them in a feasible way, and so we have not had any reports of spoilage, and that is something that would be expected to be reported to us.
Next question, please.
Yeah, this is Jerry Oster, WNAX in Yankton.
Go ahead.
So I'm hearing from home healthcare workers and others, especially as you move into the 1D with the older folks, that the seniors living alone, the 80-plus, don't have cell phones, may or may not have internet, anything like that. Is there going to be, what kind of process is there going to be for them to be notified as the vaccine rolls out?
Yeah, thank you, Jerry, for that. In addition to the information that is, of course, part of our website, we will be reaching out through newspapers, radio, and other community types of notifications. And so when we're talking about kind of that more public-facing aspect of our vaccination efforts, I would expect people to learn through ways that they get information today. I know, here in Pierre, there's daily newsletters that come out with, information that the public finds helpful. And so we'll be employing several different tactics to get the word out.
Okay.
A quick follow-up, please.
Go ahead.
So with the pace of the vaccine, what's your best guess on the timing for that, for those senior citizens?
Yeah, so, we do have a infographic on our website around, at this point, kind of what we're expecting. And again, that's if we continue to get kind of that 11,000 doses per week. And so, you can check that out on the covid.sd.gov website. But, we will remain, in the phase of vaccinating people age 80 and older, and then those with those very specific health conditions or in those specific congregate living settings, certainly into next week. So it will, with 11,000 doses, the entire 1D population, again, that's 1D as in dog, is estimated to be about 265,000 people. So if we don't see increases in allocation, it will obviously impact how quickly we can get through that population.
Okay. Next question, please.
Ray from Kettleland.
Go ahead, Ray.
Hi. So conceivably with the vaccination distribution in a congregate setting, if you're looking at 80 and over first and those with other severe conditions, so if I'm living in a congregate care facility, some of my neighbors could get the vaccine and then it could be a couple weeks before I would be able to get the vaccine. And so you could see some phased approaches like that.
So, Ray, the way it works when we're talking about people that live in a facility like you're describing is that to be as efficient as possible, that residents of the whole facility would be offered the vaccine. That's very similar to how it was with our long-term care facilities and assisted living facilities, in that, again, remember this vaccine requires special handling, requirements, and again, our goal is shots in arms, and so we want to do that efficiently as well. So if we're getting to a congregate living setting, it won't be just for people that are of a certain age or with certain health conditions. It will be available to all of them.
So that would apply to organizations such as Lifescape with residential living.
That's correct. Now, again, they may have more than one building, and so it may, logistically work out to be, certain buildings are offered the vaccine together on certain days. But again, it won't be parsing out individuals within those residential settings.
Okay, thank you.
We have time for one more question. Can I please have the last question?
This is Kelly Hertz from the Yankton.
Go ahead, Kelly.
I was wondering on the list in Phase 1E, why are firefighters rated so low? Because they're rated, it looks like, according to the graphics on your poster, along with flight attendants and things. They deal with the public all the time. Why are they rated lower than other emergency personnel?
So, Kelly, thank you for that question. So when we were developing the priority groups for the South Dakota vaccination plan, we needed to weigh the numbers of people along with their risk of contracting COVID, specifically for some of those employment situations, the risk of contracting COVID within their employment settings. And, obviously want to also balance out the fact that we know COVID really impacts particularly older people and people with underlying health conditions at much higher rates. And so fire service personnel, I wouldn't consider them. They're still in Phase 1, along with other essential workers. And, we hope to get to them as soon as possible. Now, any firefighters that do serve as EMS or, fit any other kind of category are going to be able to be vaccinated in that first category, and that applies kind of across the board to all of our priority groups.
And this is Dr. Clayton. The one thing I'd also like to mention is that within that 1E priority population, there's no hierarchy in terms of which group is coming first within 1E, and so when you're looking at all of those individuals in 1E as opposed to being a layered distribution and having firefighters at the bottom of that.